Okay, so we're looking at the muscles of the face here. So we can start with the frontalis, which should be this frontal muscle up here, right over the frontal bone. The temporalis. Okay. We have our orbicularis oculi, which is the muscle that surrounds the eye itself. The orbicularis oris surrounds the mouth. Okay. On the side here we have the rissoris, the zygomatic major, the zygomatic minor, okay, the buccinator, the masseter, okay. Sternocleidoid mastoid is around the side over here. Right here on the side. Sternohyoid would be down here. Okay. The platysma is not apparent on this particular model, but it is a layer of muscle that wraps and connects to the lower point of the jaw and kind of covers up this material.
Second layer, right?
So we're looking at the chest plate here. Okay. So we can first see the pectoralis major, it's the large muscle here, the external abdominal obliques here. Okay, so these are the superficial muscles you can see on the front. If we were to cut those away, you could see the muscles on this side. Okay, so now we have our pectoralis minor, which are these muscles here, kind of look like they're connecting to the ribs. You have the internal abdominal obliques on the side over here. So you can always tell the difference between your external and internal. The externals flow down into the abs. Internals are always flowing up into the abs. Okay, our rectus abdominis are your ab muscles themselves. Linea alba separates the left and right side. Okay. Our internal intercostal muscles, so this is the intercostal cartilage. The muscles on the inside are the internal. The external are going to be more towards the outside, more laterally located. You can usually see them kind of in between the pectoralis minors and also right here. If we flip it over, you also have the transverse abdominis right here. Okay, so looking at the full body model here, we can see coming along the sides here, on either side there, as well as over here, is my serratus anteriors. Okay, so they make this kind of serrated edge along with my external obliques. Okay, if we look on the side here, the model doesn't fall over. You can see my deltoid muscle right in the middle of the screen here. And coming off the top of it, kind of right here along the neck. Let me see if I can zoom in on that a little bit. Is my levator scapula right here. So this is what elevates your scapula, which would be right here. Okay. Okay, so now we're looking at the back. The first large muscle we can see stretches all the way down here. It would also be on top of this, but again we've removed that muscle here. That's our trapezius, your traps. Your latissimus dorsi is this muscle right down in here. Okay, so your lats right at the back. Again, it's been removed from this side. So underneath the trapezius we can see our rhomboidiuses. So this is our major and our minor. Okay. I've removed the deltoid from right here, so underneath that we're looking at the back of the arm. So if this is the spine of our scapula, you have above it supraspinatus, below it infraspinatus. Then there's two extra muscles here. You have one on the bottom way down here. This is our tres major and our teres minor. Okay, so now we're looking at the forearm here. Okay, so I tell people when they're studying the forearm to try and find a pattern. It just makes it easier to grasp all the muscles associated with this. So you start with a muscle that's easily recognizable. For me, that's the pronator tres. Okay, so it kind of goes the opposite direction of all the other muscles here, and it sits back here. Okay, so now I'm going to move towards the thumb again. So as I rotate, I have the brachioradialis. Keep going. Okay, so now I've got my extensor carpi radialis, my extensor digitorum, my extensor carpi ulnaris, my flexor carpi ulnaris. Spin around to the bottom here. Got my palmaris longus, so that one's easy. If you follow it up, it goes to the palm, hence the name palmaris longus. And then finally we're back here at the flexor carpi radialis, which my pronator tres sits on top of. Now you also have a few muscles kind of underneath. They make layers here. So underneath the palmaris longus, so find our palmaris longus here. If we look underneath that is my flexor digitorum superficialis. So it's the most superficial underneath there. Underneath that is my flexor digitorum profundus. Now underneath the brachioradialis, get these out of the way, right here is the supinator. Okay, so now we're looking at the top part of the leg. Okay, so the first thing we can look at is kind of inside of the pelvic girdle there. So here's the iliac crest, you can see up here. This will be my pubic symphysis just for orientation. So inside of the iliac crest is the iliacus. Okay, this large muscle here is called the psoas major, spelled with a P. Okay, so now we're looking at the quadriceps. So this is the front part of the leg. You can see the kneecap right down here. Okay, so starting medially, we can see our vastus medialis, our rectus femoris, vastus lateralis. Okay, you can also see this long muscle. It's easily recognizable. It kind of crosses the whole leg, called the sartorius. Okay. This little muscle right up here is the pectineus. This muscle right here is part of the abductens group, so this is our abductor longus. The gracialis, abductens magnus. So rotating around, we're at the hamstrings now. The semitendinosus sits medially and sits on top of the semimembranosus. And we see our biceps femoris. Next to it, those are our hamstrings. The last muscle up here is the tensor fasciolate. Okay, so now we're looking at the lower part of the leg. So we'll start at the back here. We have this large bulbous muscle here. It's our gastrocnemius, the calf muscle. The gastrocnemius sits on top of the soleus, so that's this muscle directly underneath it, so you can see it bulging out on either side of it. Rotating medially, you can see your flexor digitorum longus here. Okay, so it's just behind our tibia, which is this bone right here. On the front side is the tibialis anterior. Keep rotating around. We have our extensor digitorum longus. Okay, so you can follow it and it actually goes all the way to the digits, so that's an easy way to remember that one. Behind that is the fibularis longus, which is this one that runs all the way down, and the fibula brevis, which sits right underneath it, right here. So I think longus because it comes all the way down, and brevis because it's brief. Okay. Go back to the gastrocnemius here. Underneath it, we can see a few more. You have your flexor digitorum hallucis, and then your posterior tibialis. So the anterior is in the front, posterior in the back.